Hi, my name is Esther and I'm applying for the San Diego State University's Master's in Marriage and Family Therapy program for fall 2022. I'm about to graduate my bachelor's degree in psychology from Adelphi University this coming December 2021. Okay, so the first question is, tell us what you're most passionate about in becoming a mental health professional, counselor, or marriage and family therapist. So in as few words as possible, I'm passionate about becoming a marriage and family therapist because of my desire to connect with people and walk them through difficult times. I also believe that quality mental health care is a human right, and I want to do what I can to make that more accessible to people who are in need. I'm currently working towards this goal in a couple internship placements. Both of them have allowed me to work with people from different backgrounds in a therapeutic context. At one internship, I've had the opportunity to conduct and observe numerous intakes with people who are seeking treatment for anything from substance use disorder to medical trauma to personality disorders. I've also been able to lead guided meditations for people in group therapy sessions. Working with this organization has given me the opportunity to work with therapists who practice from a really holistic viewpoint and see how treating patients from a trauma-informed, evidence-based background works, and I plan on bringing this knowledge into my own practice. At my other internship, I am providing employment services to adults with autism. I work directly with them to construct their resumes and cover letters. Then I provide interview coaching and job etiquette training. I've also had the opportunity to mentor another intern on social media and graphic design skills. This position has strengthened my communication skills and has improved my ability to see the world from the client's perspective. I also joke that I have many years of clinical experience, but it's from the patient's point of view. I had an incredibly frustrating time trying to find good help or even identify what my mental health issues were, and I spent a lot of my life really disappointed in my quality of care. And when I was finally able to find a clinician who viewed me and the problems I was experiencing more holistically and in the context of a family system, I started making amazing progress and my life really dramatically improved. The thought of being the therapist that breaks the cycle of either lack of treatment or of receiving substandard treatment is what drives me. And this degree is my next step in that process. So my next question is, what do you most want to learn in your choice of program? The reason I'm aiming for SDSU to study for my master's in marriage and family therapy is because I feel really confident that I will learn not only the fundamental skills that are necessary for me to practice, but I will be taught them through a lens of cultural and contextual awareness and sensitivity. It's very important to me to be in a program that trains therapists to examine cultural biases to facilitate safer and more inclusive treatment. In addition to this, SDSU offers classes that directly align with the specialties that I'm considering. So I'm not completely sure what I want to specialize in just yet, and I love that this program is going to allow me to explore more options before I decide, but I'm currently really drawn to specialize in either substance abuse treatment or sex therapy. I specifically decided to apply to SDSU because these classes were offered, and there are professors such as Dr. Boyd and Dr. Hartzell-Kushenick who specialize in these topics. The next question is, what do you imagine this time will be your contribution to working with others to provide them with helpful mental health services? I feel really good and confident that the combination of the professional, academic, and personal experiences I've had in and out of the mental health field will enable me to be a very effective and empathetic therapist. If I do end up specializing in substance abuse treatment, I see myself working a few days a week in an inpatient setting and then a few days a week for myself in a private practice. I dream about eventually opening up a sober living where the emphasis is on a true holistic recovery instead of just abstinence from substance. If I do decide to pursue sex therapy, I would like to specialize on more of the medical side of things. I would like to work in conjunction with gynecologists, urologists, pelvic floor PTs, to help people with medical conditions and their partners, if applicable, to have fulfilling, healthy relationships to sex. I have really big goals. I have familiarity, passion, a deep desire to help people. Now I need formal training and further experience that will foster my growth as a competent and culturally informed therapist. I feel really confident that I'll receive that at SDSU, and I would love for my next step of my journey to be there with you guys. I thank you so much for considering me for the fall 2022 cohort in the Marriage and Family Therapy program, and I really hope to hear from you soon. Thank you.